Hello, everyone, and welcome to the National Museum of American History at your Smithsonian Institution. I'm Dr. Anthea M. Hartig, the museum's Elizabeth Macmillan Director, and it is truly my privilege to be your host at the museum's 7th presentation of the Great Americans Medal to Dr. Anthony S. Fauci. I thank you for joining us from all corners of the nation and coast to coast to witness this historic moment. But first, it's important that we acknowledge the precedence of the Piscataway and Nakostin tribes and their descendants. Here in the Chesapeake Bay region where I am, it's still home to many indigenous peoples from all over the hemisphere. We give our respect and gratitude for this opportunity to gather tonight on this land. Today, we present Dr. Anthony S. Fauci with the National Museum of American History's signature honor, the Great Americans Medal, awarded for a lifetime of contributions embodying American ideas and ideals. This medal is given to individuals who have not only made a lasting impact in their fields, but whose humanitarian and philanthropic endeavors set them apart. The Great Americans Medal honors recipients' accomplishments and influence on American history, and their connections to the stories told through the museum's collections and exhibitions for a broader understanding of our shared democracy and values. As an institution that documents how infectious diseases and Americans respond to them have shaped American history, Dr. Fauci's work is particularly meaningful to us. Past recipients of the award include Madeleine K. Albright for her skill and diplomacy in making the world a safer place, General Colin L. Powell for his leadership on the battlefield and statesmanship across the diplomatic front, Thomas J. Brokaw for his commitment to journalism and his steadfast defense of freedom of the press, Cal Ripken Jr. for presenting American ideals of hard work and perseverance, Billie Jean King for shattering gender stereotypes in sports and leadership in the fight for women's and LGBTQ rights, and recently Paul Simon for his global environmentalism and ability to build bridges across generations through sound and music. We remain deeply grateful to Smithsonian Regent David M. Rubenstein for his generous support of the Great Americans program and for his conversations with recipients that anchor each event. The Great Americans Medal itself is struck in 1.85 ounces of fine gold. This specially minted presentation medal features an American eagle with sun rays on the obverse or head side, with the words Great Americans and National Museum of American History engraved around the edge. The reverse side honors one of the museum's treasures, the Star-Spangled Banner, and the Smithsonian's mission for the increase and diffusion of knowledge. Created by Michael Guilfoyle, the medal is inspired by the museum's rare double eagle coins designed by sculptor Augustus St. Gaudens, who was enlisted by President Theodore Roosevelt to design the $20 gold piece. Our special thanks to museum board member Jeff Garrett, who made the medal possible. Now, we are here to award the 7th Great Americans Medal to a truly exceptional Great American, Dr. Anthony S. Fauci, for his extraordinary leadership during the COVID-19 pandemic and his distinguished career leading federal research and policy on infectious diseases. Dr. Fauci helped pioneer the field of human immunoregulation and has guided the country through numerous public health crises as the director of the National Institute of Health's National Institute of Allergy and Infectious Diseases since 1984. He has proudly served 7 US presidents on domestic and global health issues and was one of the principal architects of the President's Emergency Plan for AIDS Relief. Dr. Fauci made seminal contributions to the understanding of how HIV destroys the body's immune system and was instrumental in the development of treatments that have enabled people with HIV to live long and active lives. Most recently, he has worked tirelessly as a trusted voice for science and evidence-based decision-making during the historic COVID-19 pandemic. Let's watch together a short video about Dr. Fauci's remarkable career and his impact.
I've served 6 presidents, and I have never done anything other than tell the exact scientific evidence and made policy recommendations based on the science and the evidence.
For more than 50 years, Dr. Anthony Stephen Fauci has been a trusted voice in the public health sector. The Great Americans Medal honors him for his extraordinary leadership during the COVID-19 pandemic and distinguished career leading federal research and policy on infectious diseases. Dr. Fauci was born and raised in Brooklyn, New York, to Eugenia and Stephen Fauci. His father was a pharmacist who owned a neighborhood pharmacy. As soon as he was old enough to ride a bike, Dr. Fauci was often seen delivering prescriptions to his neighbors, beginning a lifelong relationship between medicine and people. Attending Regis High School on Manhattan's Upper East Side, he was instilled with a Jesuit philosophy and was even captain of the basketball team. In 1958, he was accepted into the College of the Holy Cross, where he began his medical education, eventually advancing to Cornell University's Medical College, where he graduated first in his class. In 1966, Dr. Fauci was called to serve in the Vietnam War. He joined the U.S. Public Health Service and was assigned to the National Institute of Health, where he began a 5-decade career. In 1972, he became a senior researcher at the National Institute of Allergy and Infectious Diseases, or NIAID. Dr. Fauci began groundbreaking immunoregulation research and therapy advances in polyarteritis nodosa, Wegener's granulomatosis, and lymphomatoid granulomatosis. But in 1981, his work took a pivotal turn when a novel virus began affecting clusters of the population.
And as I've often said, that was literally the first time in my medical career that I actually got goose pimples, because I knew there was something very wrong and very new here.
Surprisingly few people are familiar with the Acquired Immune Deficiency Syndrome, or the acronym by which it's frequently identified, AIDS.
Dr. Fauci and his team began researching the virus that was predominantly threatening the lives of gay men. He began advocating in the medical community to get the attention of both researchers and regulators. Though he met resistance from the LGBTQ community, who felt largely ignored by the government.
There are more lives claimed, victims claimed, than toxic shock and Legionnaire's disease combined. And yet most of the country doesn't know about this cancer.
Why?
Well, I think it's because it's a gay cancer.
His relationship with activists evolved as he slowly became a trusted mediator.
What they had to say was something that was really, really important. And if you listened to them and read what they wrote, it made sense.
Dr. Fauci has made seminal contributions to the understanding of how HIV destroys the body's defenses, leading to its susceptibility to deadly infections.
We know now that it is caused by an infectious agent, that it is a transmissible disease.
With his experience and research, he helped build George W. Bush's emergency plan for AIDS relief, which saved millions of lives in Africa and around the world.
I know for sure that when the history of AIDS is finally written, Anthony Fauci will be remembered as one of its heroes.
In 1984, he was later appointed as the director of NIAID and has remained in his position since. A trusted advisor for government officials, Dr. Fauci has served on the health board for 7 administrations. His groundbreaking research of the human immune response in diseases such as tuberculosis, malaria, and Zika has made him a pioneer in the field of human immunoregulation. During Ebola, Dr. Fauci continually pushed the vital importance of screenings and worked towards treatments.
We have been working on an Ebola vaccine for several years in an iterative process that we've improved upon.
As an internationally recognized infectious disease expert, Dr. Fauci has been an authoritative, trusted voice during the evolving COVID-19 pandemic and a top advisor to the United States medical response efforts. With the Center for Disease Control, he continues to work to inform and prepare the public by advocating for social distancing efforts and giving uncompromised, scientifically accurate updates and recommendations.
We have already started at the NIH and with many of our collaborators on the developing of a vaccine.
The National Museum of American History is collecting across the many ways the COVID-19 pandemic has affected every aspect of American life. Dr. Fauci's impact can be seen in the image of a New Yorker using his T-shirt to display his support and in the invitation by the Washington Nationals to throw out the first pitch. The museum's collections have added these to archival materials that connect to his earlier work in HIV/AIDS. The history of this pandemic is being documented in real time, and we know that a figure at the center of this story is Dr. Anthony S. Fauci. Dr. Anthony S. Fauci, physician, scientist, public health official, humanitarian, and now the Great Americans Medal honoree.
Dr. Fauci, on behalf of the National Museum of American History, it is my great honor to virtually present you with the Great Americans Medal. How I only wish we could do this properly in person. Looks great on you. Allow me, please, to read the citation. The National Museum of American History proudly presents the Great Americans Medal to Anthony S. Fauci, MD, for his enduring commitment to public service, his tireless and extraordinary leadership during the evolving COVID-19 pandemic, for a lifetime devotion to the treatment and eradication of infectious diseases from HIV/AIDS to Zika, for his unwavering belief in the power of science and using that power to save millions of lives, and for working for the American people with integrity, passion, dedication, and humanitarianism for more than 5 decades. Through these values and achievements, he defines service at the highest level and exemplifies the true meaning of a great American. March 2nd, 2021.
Thank you very much, Dr. Hardig. It's really an extraordinary and humbling honor to receive this award from the Smithsonian Institution, which I have, all of my adult life have held in the highest esteem of one of the great American institutions. To receive an award for what I do with my life from an institution that I have such great respect for is really extraordinarily meaningful to me. And I want to thank you and all of the leadership of the Smithsonian for conferring on me this extraordinary honor. This has been actually a terrible year in so many respects, something that when we speak about history, coming from the Smithsonian, with it's steeped in the history of so many aspects of our life, that decades from now, people will be talking about the experience that we went through. The bright side of all of this is how science has come through, particularly in the arena of the development of safe and effective vaccines, which ultimately is going to be the end game of getting out of this, in addition to adherence to the public health measures. So as a scientist and a public health official, I feel privileged to be here in many respects representing so many people in the field of public health, of medicine, of healthcare, and in basic and clinical science that is making the ultimate success that we will achieve with this outbreak, making it possible. So again, thank you very much for this extraordinary honor. I am much appreciative. Thank you.
Thank you so much, Dr. Fauci. During the past year, the museum has canvassed the nation, asking our public what we should collect to remember and document this unprecedented pandemic. And in a time of cascading crises, viral, racial, economic, political, and climate, we've invited individuals across the country to share their stories of 2020 and now 2021, creating a digital time capsule for future generations. So now, Dr. Fauci, I'm asking you, if you were to donate one item to the national collections that is meaningful to you and representative of your experience, what might that be?
Well, what we have here is what I'm going to be donating is a model of the coronavirus. Now, when you see these things, these are called the spike proteins coming out of the coronavirus. If you cut it this way, as you do when you take an electron microscope, you see these things stick out, and they are spikes that look like a crown. And that's where you get the word coronavirus, because it stands for a crown. But this particular spike that's coming out is actually the part of the virus that the body makes an immune response against to protect you against getting infected with the entire virus. So I received the mRNA vaccine, which codes for this protein. So right now, my body is making a response against this particular protein, which prevents me from getting infected from the whole virus. So this is what we will be donating to the Smithsonian. Thank you.
Oh, that's so wonderful. Thank you. So and I'm so glad that, of course, you're vaccinated and you're starting to decrown the crown. And we will hold that, of course, and treasure it. It will become an incredible addition to the museum's outstanding collection of medicine and science. So thank you very much. It's my pleasure now to introduce Smithsonian Regent David M. Rubenstein, a good friend to all, and especially to the American History Museum. He'll speak with Dr. Fauci about the arc of his life and career, and it's truly a pleasure to bring you both to the screen.
Thank you very much, Dr. Fauci. Thank you very much for being here with us. Let me just start by asking you, did you ever consider that life would have been easier for you if you had started in some other area of medicine other than infectious diseases? You could have gone into dermatology, which is, doesn't have weekend hours or something like that. Why did you pick infectious diseases when you were in medical school to be a specialist in?
Well, David, I picked infectious diseases for two reasons. One, I was very interested in the evolving discipline of human immunology, which, as when I was in medical school taking my internship and residency, I decided to take a fellowship in a combined discipline of clinical immunology and infectious diseases here at the National Institutes of Health, because I was interested in how the body defends itself against various assaults, particularly of infectious diseases. Also, I believe it was just my temperament and the things that I like to deal with is I like serious situations, and infectious diseases can kill you pretty quickly, but also there are interventions that work. You can prevent them, you can treat them, but also they have global health implications. They can be in epidemic form, which has fashioned many societies. So there's so many aspects about infectious disease that was attractive to me. The fact that you can do something about it, the fact that you can save people's lives because infectious diseases kills people. Historically, prior to the time when we had vaccines and antibiotics, overwhelmingly the leading cause of death in the world were infectious diseases. So historically, it's a very, very important discipline.
So when you were going to go to medical school, did you tell your family you were going to be a doctor and they presumed you'd be a doctor down the street who they could go do visits with, or that kind of doctor? And did they encourage you to go to medical school?
I would say they were probably pleased that I decided to go to medical school. My training prior to medical school was much more geared towards the humanities and classics. My pre-medical training, even as far back as high school, was very much steeped in the Jesuitical tradition of the classics: Greek, Latin, Romance languages, philosophy. I became interested in science because of, the discovery nature of science. And I liked that. And I found that I had two leanings. One was to science, because I thought it was exciting and interesting when you think about discovery of the unknown. But also I had a very strong leaning towards wanting to be involved with people, because of I believe, my natural proclivity to that, but also because of my training in the humanities. So the way you can combine both science with dealing very, very deeply with the persona of people, medicine seemed to me to be the natural choice.
So you mentioned high school. You were a high school basketball star. Did you ever consider playing in college or in the NBA, or you're not quite ready for that?
Well, I was a basketball player in high school, a pretty good one. But among the things I inherited from my father was speed, which made me a good basketball player because of the game we played back then, but also height. I found out very early on that as fast and as good a shooter you could be, I'm 5'7", and a 5'7" point guard will always get completely crushed by a 6'5" point guard. And it was at that point, that aha moment, David, when I said, I better go into medicine.
Okay. So you went into medicine, you went to the NIH, but when you joined the NIH, I think in 1968, you went to the NIH around then.
Right.
Did you think this would be your entire career? I mean, many people go to the NIH and then they go elsewhere. You've been there since 1968, I think it is. Did you ever consider that was what's going to be your entire career at that time?
No, absolutely not, David. When I went down to the NIH, my plan, since I was very much interested and still am, despite my career path has taken me away from this on a daily basis, my great love and desire was to take care of patients. So I came down to the NIH in 1968 to do a fellowship in infectious disease and immunology with the full intention of returning back to the New York Hospital Cornell Medical Center and being on the faculty in the hospital, teaching, doing maybe a little bit of clinical research, but fundamentally taking care of patients. But when I came to the NIH, after about a year and a half to two, I got bit by the science and discovery bug. And I didn't want to give up taking care of patients, which I still have not, but it just changed the direction of my career. And that's why I decided, after going back to New York for an additional year as chief resident in medicine, that I would come back to the NIH. And I've stayed here ever since because of the extraordinary opportunity to combine clinical medicine with science.
Okay. So when you went to the NIH at the beginning, you were there with a lot of people who've gone on to win Nobel Prizes and so forth. So it's a very august group of people. Did you ever think that if you went off and did research only and didn't have to deal with patients, you too would have already won a Nobel Prize? You've won every other prize there is. There's no other prize left. And you should get a Nobel Prize for what you've done. But any jealousy? All your friends won Nobel Prizes and you haven't won yet?
No, it doesn't work that way, David. I think if you do something for the purpose of winning a Nobel Prize, 99% of the time, you're going to get very disappointed. So the gratification you get is to what you're doing and what you can accomplish. If rewards and prizes come, they come. But that's not the underlying reason why you do it. So I've never felt, but you're right. Several of my friends who came down here actually did win Nobel Prizes.
So I came to you, I think a story that I told some others, and we've talked about it before, when you were 70 and said, okay, now's the time you might slow down and maybe ease up and maybe retire even and go into the higher calling of private equity, do healthcare investing in the infectious disease world, I suppose. And you said, no, you didn't care about making money. You're still uninterested in pursuing, a more lucrative career. Is that correct?
That is correct, David. That is correct. I'm sorry I disappointed you, David.
Okay, I understand. So let's go back to infectious diseases for a moment. Early on in your career, and you've been the head of the NIH Infectious Disease Institute for, I think, since 1972. But early on, you worked on a whole variety of different infectious diseases before we get to AIDS. What were the things that you most focused on before AIDS came along in the 1980s?
Yeah, I was doing less primary infectious diseases, David, than I was doing what's called rheumatologic or inflammatory diseases. I was very taken up by the effect of immunosuppressive agents on autoinflammatory diseases like vasculitis. There's a group of unusual diseases, not rare, unusual, but not really rare, that are inflammatory diseases of the blood vessels that lead to kidney failure and lung failure, highly, highly lethal diseases, almost 100% mortality. And for the first, I would say, 9 years from 1972 on, I was fortunate enough, with the help of some generous mentors, to develop rather significant protocols that led to the remission, if not cure, of these diseases. So it was less primary infection in my research. Clinically, I was an infectious disease consultant for the other institutes at the NIH Clinical Center. But my primary interest were these autoinflammatory diseases. And it was only in 1981, in the summer of 1981, when the first cases of what would soon be called, but wasn't yet named, AIDS, without a etiology, we did not know what it was. I sensed that this was going to be something that was going to be extraordinary and would spread throughout the world, because even though we didn't know what the agent was, it was very ominous because it was spreading like wildfire, particularly among gay men. We incorrectly thought at the time that this was a disease that was very specific for gay men, and it was not. Globally, we didn't appreciate it, but it was in Africa already under the radar screen, infecting predominantly heterosexual couples. So I started in 1981 studying a disease with no name and no etiologic agent. And for the last literally, 40 years, I have been one way or another very deeply involved with HIV/AIDS.
Now, you were approached by, or you saw President Bush 43 in the Oval Office at one point, and he asked you what we can do about AIDS, and particularly in Africa, where it was still fairly endemic. What did you tell him, and what has been the program that has resulted from your meetings with President Bush?
Well, this is something that has gone down as the extraordinary positive legacy of President George W. Bush. We had developed life-saving drugs beginning in the mid to late 80s, and then the culmination of combination therapies in 1996, which got better and better, so that by the time we got to the turn of the century, we were having a complete transformation of the lives of persons living with HIV to the point where they could essentially live almost a normal lifespan. The president was aware of that. I was acutely aware, because when I would go to Africa on frequent visits, it was very painful for me to see that things that I was doing many years ago in the 80s, frustrated of seeing all my patients die because we didn't have any drugs. Then when we developed the drugs, we completely transformed their lives. But in Africa, there was no availability of drugs for prevention, for treatment, nor was there any really good care. And I was hoping we could figure out a way to get the developed world to help out because we had life-saving therapy. President George W. Bush had the same idea. And he called me into his office and said, you know, we have a moral obligation as a rich country that other people in the world who are less fortunate than we should not have to die because of the place they were born and the economic situation of the country that they're in. So he asked me to put together a program to see if we could care, treat, and prevent HIV in the developing world. And we put together a program that has been now spent billions and billions of dollars. And to his great credit, he established the program. He lobbied to get money for it. The Congress was very generous in giving us money. But now we have what we call the President's Emergency Plan for AIDS Relief, which has saved anywhere from 14 to 17 million lives already.
Now, when you were working on AIDS and later when you were working on Ebola, which you also spent a lot of time on and trying to help cure that problem, you did still see patients, as you said, you still see them now. When you go into a patient today and do they call up their friends and say, Dr. Fauci is my doctor? Do they want pictures with you and selfies, or how do you deal with that because you're so famous now?
Well, the answer, the truth is that yes, that didn't happen before, but now patients and families, when they see me come in, they do want to take selfies or take pictures, which is good. If it makes them feel good, then it really makes me feel good. Same thing with the nurses and the doctors on the ward, who are also that way. Yeah.
Did they ask you to sign their bobbleheads, the Tony Fauci bobbleheads, or not?
David, the answer is yes. I mean, you're asking embarrassing questions, but it's
okay. So let's go to the current situation that everybody's been focused on for quite some time. About a year ago, I guess it was, or so, we first heard of this disease, and it seems from China. Do you think it came from a wet market, from a laboratory, or from something we just don't know?
Well, it is very, very likely, if you look at the sequence of the virus in animals, particularly bats and other intermediate hosts, that it was evolving towards what we see now in human, that it is very likely that what we had was a jumping species, likely from a bat, which these coronaviruses like to be in bats and do very well in bats, perhaps to an intermediate host, which likely really came into contact with humans when you bring close that animal-human interface. And one of the places, particularly in China, where that occurs frequently, is in what's called wet markets, where people come in and buy animals straight out of the wild, usually for festive dinners of some sort. And that's how you can have the possibility of jumping species. And then once it adapts itself to humans in a way that can be spreading efficiently. I mean, obviously, there's always this theory about the possibility of it escaping from a laboratory. It's very difficult to disprove that, but the overwhelming likelihood is that it was a natural evolution from the wild.
Okay. So do you feel that today, as we're talking, the worst is behind us for this virus, COVID-19, that we are on the way to seeing the light at the end of the tunnel? Or you think it's too early to say that?
You know, even though we are now, despite having gone through a terrible year plus, where 500,000 people died in America and over 2.6 or 7 million people died worldwide, we're not through with this. We have vaccines that are highly efficacious. We know that there are public health measures that we can implement to blunt the spread. And even if we successfully do that, which it looks like it's going in the right direction now, if you look at the daily curves of infections, they're precipitously going down. The one thing we don't want to do, David, we don't want to declare victory prematurely and pull back on preventive measures. We want to continue those public health measures, and we want to get as many people as quickly as possible vaccinated. The one thing that I must mention that plays into the answer to your question is that this is a global pandemic, which requires a global solution. So if we take care of ourselves and the other developed nations take care of themselves, and we let the outbreak rage in the developing world that don't have the resources to get vaccinations, even though we control it in our own country, there will always be the looming threat of variants of the virus getting back to the United States and eluding the protection from a vaccine. And we already know there are mutational variants that are taking place not only in the UK and in South Africa, but really in our own country. So we've got to make sure we have a global response together with other nations in the world and not just think in terms of our own country.
Are you worried that the so-called South Africa mutant or the British one can overcome the vaccines we've already developed? Or do you think right now our vaccines are strong enough to overcome those variants?
The vaccine that we're distributing now, the Moderna and the Pfizer vaccine, and likely soon the J&J or Janssen vaccine, appears to work very well against the variant from the UK, the one we refer to as B117. The one from South Africa is a bit more problematic. The response to the vaccine that induces these antibodies, the effect that those antibodies have against the South African strain is diminished several fold, likely somewhere around 5 or 6 fold, enough to diminish the effectiveness of the vaccine, but not to eliminate it. And in fact, thank goodness, it appears that the vaccines, although they may be diminished in their efficacy against mild to moderate disease for the South African isolate, it still seems to be able to protect against severe disease, such as hospitalization and deaths. But we should not take too much comfort in that, because there's the continual evolution of these variants that we need to keep an eye on. And ultimately, we might have to adjust and upgrade the vaccines to keep up with these variants that are caused by these mutations.
Before we had the vaccines, we had concerns about, I'd say, equipment for masks for everybody and equipment for doctors and also testing. Do you think we've learned how to be better prepared for a future pandemic, and our testing abilities are better now than they were 6 months ago, and we have all the PPE we need?
Well, the answer to that is yes, a little late in coming, but yes, I hope that we hold on to that corporate memory of what challenges we had when much of the equipment that we needed was made in other countries. We need to realize that we have to begin to start making sure that within our own boundaries of our own country, we can make the kinds of things that you need, be it PPE or anything else that you would need. So I hope that lessons will have been learned so that we're better prepared for what I think is inevitable, maybe not in our lifetime, but inevitably we're going to get more outbreaks, and some of them may be of the pandemic nature that we're seeing right now.
Now, the Kennedy Library in Boston hands out annually, I think annually, Profiles in Courage Award, and I want to nominate you for that because I assume it wasn't that easy to stand in the White House press room and say to the President of the United States, you know, I'm not sure you're exactly right on that. Was that complicated for you with President Trump to kind of have to, let's say, modify what he said?
Well, it certainly wasn't easy, but I had to do it, David, because one, I had to do it for my own integrity, to not being able to just hear something that was not correct. and allow it to be said without, when you have the opportunity for saying, no, that's not correct at all. It's not easy to do that. I don't take any pleasure at all in contradicting the President of the United States. I have a great deal of respect for the office of President of the United States, and that was not easy, but I had to do it. As you know, historically, it certainly didn't put me in good stead with certain members of the administration. You know, there were others in the administration who really were quite good, working with them closely to try and do as best as we can.
Did you ever think you were going to get fired for what you were saying?
No, there was obviously a lot of talk about that, David. I didn't think that would happen. If it did happen, you know, so be it. I wasn't going to change my approach towards acting only on evidence and only on solid science. If that got me fired, so be it. I didn't think that was going to happen, though, because I think that would have probably been more problems for the administration than for me.
How many presidents have you actually worked for?
7.
7. Okay. Now you're working for your 7th. What is your current position? I think President Biden announced that you were also his medical advisor in addition to staying at the NIH. Is that right? What do you do in that role now?
Well, my title is Chief Medical Advisor to the President, but I'm really, quite frankly, part of a team of really good people who are involved in the medical approach to how we're handling the outbreak. So it isn't just me alone. I wouldn't want people to think it's just me. We have a team of people, the director of the CDC, Rochelle Walensky. We have Vivek Murthy. We have so many people, Andy Slavic. The group is led and coordinated by Jeff Zients, who also important. We have Marcella Nunes-Smith, who is the head of the task force on equity, and a variety of other people, many people there who are working as a team. So even though I have a title of the chief medical advisor, it's really a lot of teamwork.
Now, if somebody were to get COVID-19 today and they had to go to the hospital, would they get better treatment than they would have 6 months ago because we know better how to treat that? Or it's still life-threatening to people? Obviously, people are dying every day, but how do you assess the ability to treat it today? And why are so many people still dying?
Yeah. Well, so many people are still dying, David, because it's a very, very serious disease. And particularly in those people who are the elderly and those with underlying conditions. But we're starting to see even more and more now that even young, sometimes healthy people who with no explanation for why they deteriorate are doing really quite poorly. Still overwhelmingly, the people who actually die from the disease are the elderly. I mean, if you look at the percentage of people who get hospitalized and die, it's very heavily weighted towards the elderly, particularly those with underlying conditions. But it is a very serious disease. But in direct answer to your question, in any disease, even when you don't have highly specific interventions, the more experience you have in taking care of people, even without specific therapies, the better off people do ultimately. We had that same experience in the early years of HIV, when we got much more experience in taking care of the severe complications of HIV, even before we had direct antiretroviral agents.
When do you think everybody or anybody that wants to get a vaccine can get one? And do you think that if you get a vaccine, you can then not have to wear a mask, you don't have to wash your hands, you don't have to worry about social distancing?
Well, we're going to have enough vaccine to vaccinate essentially everybody in the country by July. As the president has said very correctly, that's the case. We've contracted for 600 million doses from 2 companies, and we likely will get some redundancy with doses from other companies. When you get past the priority group, namely when you have vaccines that are limited, when the supply doesn't meet the demand, you have to do prioritization. And what the Advisory Committee on Immunization Practices has done is they've created priorities. So the 1A is healthcare workers and people in nursing homes and extended care facilities. Then you have people who are essential members of society to make it run, as well as the elderly. Then you get people with underlying conditions. Once you get past all the priority groups, by the time you get to what's considered the normal, healthy person who has no priority to get vaccinated, that likely will be somewhere in May, June by the time we get there. But by August, we will have enough vaccine to vaccinate. Excuse me, I keep saying August, it's July. Correction, July. We will have enough vaccine to vaccinate everybody.
And so-called herd immunity, when do you think that will actually come about, if at all?
Well, herd immunity is going to depend very much on the number of people who actually do get vaccinated. So if everyone steps to the plate, as it were, and we get enough, as I mentioned, vaccine to vaccinate everybody by July, it might take a couple of months more to logistically get vaccine in the arms of people, which might take to the end of the summer, the beginning of the fall. So I would hope that if we get 70 to 85% of the population vaccinated by the end of the summer, the beginning of the fall, we would have that herd immunity that we would need to essentially get the level of virus so low in the community that it will not be a serious threat.
Well, given your position, I guess it would have been modestly embarrassing if you got COVID-19 when you're telling everybody how to avoid getting it. So what did you do to avoid getting it, and have you now been vaccinated?
Well, yes, I have been vaccinated. What I've done to avoid it was to practice what I preached, do the kinds of things I'm telling the American public to do: uniformly wear a mask, avoid close contact, avoid congregate settings, particularly indoor, and wash your hands very frequently. Sometimes people, even when they try to do that, there are lapses that they don't even recognize, and then they wind up getting infected. Yeah.
So you have worked around the clock, I mean, literally around the clock for over a year, and maybe you could say for 40 or 50 years, but certainly this past year, if you haven't snuck away for a little vacation to Mexico or anywhere lately?
No, I have not, David. In fact, the nature of what we do, not only me, but as I mentioned, the team of us to do this, I haven't really had a day off since, I would say, last February, namely a year. There's just too much to do. The stakes are too high. And the consequences of not giving it a full-blown effort are that people's lives get lost. So that's the kind of thing that energizes you.
So how do you stay in shape now? Do you still do your power walks with your wife every night?
I do.
Do people, when you're doing a power walk, do people in your neighborhood come up and ask for medical advice or not?
Well, no, they tend to be very generous and say hi. Sometimes they want to stop and get a selfie, but in general, they're fine and merely give me a warm hello.
Now, for those people that have had COVID-19, they got it, they survived. Will there be after effects that we don't know about yet? And secondly, should those people get a vaccine?
Okay, so a certain percentage of people, and we don't know what percent, we're going to be doing large cohort studies to determine that, but there's no doubt that a certain percentage of people have the lingering of a constellation of signs and symptoms well after they have cleared the virus from their body. Sometimes a recent study said as long as 8 months or more. And it's somewhat consistent among these people. They have extreme fatigue, muscle aches, sleep disturbances, temperature dysregulation, tachycardia or a fast heartbeat, and what some describe as brain fog, which means they have real difficulty in concentrating or focusing on a particular topic, which really for people who are otherwise perfectly well, athletic, sharp, people who are intellectually sharp are finding themselves being practically incapacitated by this. It's a very strange syndrome, and we're going to be investing or are investing a considerable amount of resources to try and get down to the bottom of it, to delineate the extent of it, to determine what the pathogenesis of it might be, and ultimately, I hope, to develop some therapy or some treatment for it.
Should they get a vaccine?
Well, people who have been infected should get vaccinated, yes.
Okay. All right. So I want to get some free medical advice from Dr. Fauci. Yesterday, I was sitting in my home and I got a call saying, come get your shot in 30 minutes. So I raced over to get my shot and now I have it here and my arm is hurting. How long is my arm going to hurt for?
It likely will be fine by tomorrow, late afternoon, early evening. It's usually 25 to 36 hours at the most. And then you might feel a slight ache, but nothing that would bother you.
They said, come back in 28 days and get your second shot. Suppose I say, I've had enough, I don't need two. Am I protected?
You're protected for a while, and the durability and the heightenedness of your protection, the degree of protection would be considerably less. So even though you'd be protected for a while, my strong recommendation to you, David, is to go back in 28 days and get the boost.
But if you go back in 25 days or 30 days, does it make that much difference? Or 28 is the exact time?
I want 1 or 2 or so days in either direction is not going to make a big difference, but don't wait too long.
Okay. So final question before we finish, Dr. Fauci. In hindsight, what do you think we have learned as a country from this experience and what we could do to deal with the situation like this again in the future if it arises better?
Yeah. Well, the one thing that looms large for me, having been through this, David, right from the very first day, is that when you have a common enemy like a virus that is emerging and beginning to devastate your country, you cannot have divisiveness. You cannot have a situation where you politicize public health, where people will or will not wear a mask as a public statement, where people will deny the reality of a devastating disease when it's looking them square in the face. You can't have that. I mean, if ever there was a time for unity within a country, regardless of any political differences, but pulling together all as a one, we're all in this together. That was not the attitude that we had, unfortunately. And I think for the next time, we've got to make sure that when we have a common enemy, let's fight them in a common way.
Dr. Fauci, thank you for your great service to our country over many, many decades, and particularly this past year. And thank you for being here today to take this award. Thank you very much.
Thank you, David. It's always a pleasure to be with you. Thank you for having me. Bye-bye.
Thank you so much, Dr. Fauci. And thank you, David. And thank you all for joining us on this special occasion. Video from this event will be available on the Great Americans website at greatamericans.si.edu. And please, as Dr. Fauci said, continue to recognize that we're all in this together. Stay safe, take good care of each other, continue to use all your COVID-19 preventative protocols. On a related programmatic note, we hope you'll consider joining us on March 23rd for the museum's next installment of its Pandemic Perspective series. This program will focus on our work collecting around COVID-19. At your National Museum of American History, our mission is to empower people to create a just and compassionate future by exploring, preserving, and sharing the complexity of our past. We believe that learning history helps people understand that today's world is the result of a myriad of choices and actions made by individuals and communities across time. We hope that, like us, you take inspiration from Dr. Fauci's life and work and his embodiment of what it means to be a great American.